Project NYG present. Essential vitamin B12. Recognizing and addressing deficiency symptoms. Do you know how much vitamin B12 you consume every day? Do you even know if you're getting enough? B12 is an essential nutrient that our bodies need to be healthy. It's responsible for making red blood cells, nerves, and DNA, in addition to carrying out other essential functions. The thing is, our bodies can't produce B12 on their own and we need to consume it through food or supplements. On average, a healthy adult must ingest at least 2.4 micrograms of B12 each day. However, some people don't consume enough B12-rich food or supplements, and others are unable to absorb enough B12, no matter how much they take in. The result is that many people develop B12 deficiencies, and you might be one of them. Plus, as you grow older, you'll become progressively susceptible to vitamin deficiencies. Experts believe that 20% of people over 50 experience low levels of vitamin B12. But most people overlook the signs, because the symptoms are varied and common among other conditions as well. If you want to catch and remedy a potential vitamin B12 deficiency, be sure not to ignore the following signs. Weakness and fatigue. One of the most common symptoms of a vitamin B12 deficiency is feeling tired and weak. Vitamin B12 is necessary for the production of red blood cells, and not getting enough of it hinders the transportation of oxygen throughout the body. This can often be caused by the autoimmune condition called pernicious anemia, which occurs when the body fails to produce enough intrinsic factor, a glycoprotein required by the intestines to absorb vitamin B12. Moodiness. Vitamin B12 is needed for essential functions in the body and mind, and deficiencies can lead to moodiness, depression, and even psychosis. This is because B12 is needed to produce neurotransmitters like serotonin and dopamine, which are responsible for mood regulation and proper brain function. When levels of these chemicals are low, depression is likely. Dizziness and shortness of breath. Frequent vertigo or dizziness are also symptoms of a vitamin B12 deficiency. These signs occur most often when suddenly changing positions, like standing up after sitting or lying down, or immediately after strenuous physical activity. This happens because the body is short of red blood cells, and without adequate oxygen, the cells in the body cannot perform their functions effectively. Pins, needles, and numbness. Nerve damage is the most serious side effect of B12 deficiencies. Over time, a lack of B12 causes reduced production of myelin, which makes up the protective sheath around the nerves. With exposed or weak nerves, the body may experience paresthesia, which is a pins and needles sensation throughout the arms, hands, legs, or feet. Numbness or limbs that fall asleep is also common. Mobility issues. If a vitamin B12 deficiency goes untreated, the nerves may deteriorate to a point where your mobility is challenged. Your ability to move, or your walking style may change, and you may find that your balance and coordination are off. This symptom is most common in the elderly, and it raises concerns about accidents such as falling. Paleness or jaundice. People with a vitamin B12 deficiency often appear pale or even slightly yellow. Jaundice is a condition that affects the skin and eyes, producing this yellow tinge. Megaloblastic anemia, a type of anemia caused by B12 deficiency, causes the bone marrow to produce unusually large and immature red blood cells. These cells are unable to function properly, leading to anemia. Other symptoms of a B12 deficiency may include diarrhea or constipation. B12 is essential for maintaining a healthy digestive system. Without enough B12, the body may experience diarrhea or constipation. Sores in the mouth and tongue. B12 is important for maintaining healthy mucous membranes, including those in the mouth and tongue. A deficiency can lead to sores or ulcers in these areas. Difficulty concentrating. B12 is necessary for proper brain function, and a deficiency can lead to difficulty concentrating and memory loss. Hair loss. B12 is necessary for healthy hair growth, and a deficiency can lead to hair loss. Changes in skin, nail, and vision. B12 deficiency can also cause changes in the skin, nails, and vision. Skin may become dry and discolored, nails may become brittle, and vision may become blurry. It's important to note that these symptoms can be caused by other conditions as well, so it's important to consult a doctor if you suspect a deficiency. A simple blood test can diagnose a B12 deficiency. The treatment for a deficiency is usually a B12 supplement or a B12 injection, and in severe cases, a high dose of oral B12 may be prescribed. In order to prevent a B12 deficiency, it's important to consume enough B12 through food or supplements. Good sources of B12 include meat, fish, dairy products, and eggs. Vegetarians and vegans may need to consume B12 fortified foods or supplements in order to meet their needs. As you grow older, it's important to be aware of the potential for a deficiency and to consult a doctor if you suspect a deficiency. Additionally, certain medications and medical conditions can increase the risk of a B12 deficiency. For example, certain acid-blocking medications, metformin, a diabetes medication, and proton pump inhibitors, used to treat acid reflux, can interfere with B12 absorption. Individuals with stomach or intestinal issues such as Crohn's disease or celiac disease may also have difficulty absorbing B12. It's also worth noting that some people may be at risk for a B12 deficiency due to their dietary choices. For example, vegetarians and vegans may not consume enough B12-rich foods in their diet. Pregnant and breastfeeding women may also be at risk for a deficiency as their need for B12 increases during these stages. In conclusion, vitamin B12 is an essential nutrient that our bodies require to be healthy. A deficiency can lead to a wide range of symptoms, some of which can be serious. It's important to be aware of the risk factors and symptoms of a deficiency, and to consult a doctor if you suspect a deficiency. By consuming enough B12 through diet or supplements, and by being aware of the potential for a deficiency as we age, we can help to prevent a deficiency and maintain good health. How did you find out, and what steps did you take to remedy your condition? Tell us in the comments below. If you found this video helpful, give it a thumbs up, and share it with your friends, so we can keep making them. For more videos like this, hit the subscribe button, and remember to click on the notification bell. Also, be sure to check out our other videos as well. Thanks for watching.